Welcome back to Face the Nation. We're continuing our conversation with Ron Klain. I want to switch gears to talk about this massive hacking of the federal government and private entities. The transition team has had some level of briefing on this. Is there any doubt that Russia was behind it?
To disclose this information in terms of who gets the blame. We should be hearing a clear and unambiguous allocation of responsibility from the White House, from the intelligence community. They're the people in charge. They're the ones who should be making those messages and delivering the ascertainment of responsibility. Instead, what we've heard is one message from the Secretary of State, a different message from the White House, a different message from the president's Twitter feed. We have been briefed on this, but again, I think in terms of publicly communicating the position of our government, that has to come from the current government, and it should be coming in a clear and unambiguous voice.
Well, the president-elect was pretty clear when he spoke to my colleague Stephen Colbert on CBS earlier this week, and he was asked about Russia, and he said they'll be held accountable. He said they'll face financial repercussions for what they did. Is that no longer the case? He no longer believes it's Russia?
No, what I'm saying is that the official statements about who's responsible for this particular attack needs to come from the administration in a clear and unambiguous way.
Okay.
What the president-elect has also said, clearly, Margaret, is that those who are responsible are going to face consequences for it, and he's going to take steps as president to degrade the capacity of foreign actors to launch these kinds of attacks on our country.
So Senator Mitt Romney said this morning the Russians potentially have the ability to target U.S. utilities and cripple the U.S. economy. Is that your understanding of what these hackers have the ability to do right now? And are sanctions as far as the president-elect is willing to go?
Well, so I think there's a lot of uncertainty still about what the purpose of these attacks were. Were they espionage-oriented? Were they designed to inflict damage on us? I agree with Senator Romney about the capacity of foreign actors. I think there's still a lot of unanswered questions about the purpose, nature, and extent of these specific attacks, and we're looking forward to learn more about them. I think in terms of the measures that a Biden administration would take in response to an attack like this, I want to be very clear. It's not just sanctions. It's also steps and things we could do to degrade the capacity of foreign actors to repeat this sort of attack, or worse still, engage in even more dangerous attacks.
Okay. Have the two, I'm hoping you can
and
still...
And now, Margaret, I've lost you again. I'm sorry, but the connection's been severed once again.
All right. Just when I was going to ask you a follow-up there, but Ron Klain, thank you very much for joining us. I'm sorry to our viewers for the continued technical problems on that, but we are lucky because we do have our next guest here, and that is on the topic of COVID-19. You all may remember that when President Trump was diagnosed with COVID-19 back in the fall, he was treated with a therapeutic antibody made by a company, Regeneron. Pharmaceutical company Eli Lilly makes a similar drug that has been distributed to states across this country through Operation Warp Speed. This morning, we're joined by their chairman and CEO, David Ricks. He's in Indianapolis. Good morning to you.
Morning, Margaret.
We wanted to talk to you about your treatment with monoclonal antibodies because we learned this week that while taxpayers have purchased about $1 billion of it to treat patients, only a fraction of it is actually being used. And we're in the throes of a crisis. Why isn't this being prescribed more?
Well, it's disappointing news that we heard as well. I can tell you that across the country, we've shipped and distributed broadly the monoclonal antibody from Lilly. And then in our clinical studies, it reduces the risk of hospitalization by about 70%. So it's very important that those eligible talk to their doctor about getting this therapy. What we have seen, though, is differences in how different states and different hospital systems have chosen to act. Some really good cases where it's quite easy when your doctor recommends this to get the infusion. It's an infusion. It takes about 2 hours. And we've seen cases where there's been little or no action. So it's important people know to ask their doctor if they're a candidate for this therapy.
And when you say infusion, you mean someone has to go and get hooked up to an IV to treat it.
Correct. Yeah.
But I want to follow up on something you just said, because it's similar to what the Trump administration has said over the course of this week, which seems to put the onus on the patient to tell their doctor what to prescribe them. That's not usually the doctor-patient relationship. If we accept that's the premise, and it's our job to tell the doctor to prescribe us, how soon are they supposed to ask for it?
Well, I'm not suggesting it's only the patient's responsibility, so let me come back to that. But the drug is indicated in the first 10 days after a positive PCR test, a confirmation of COVID-19. And within that 10-day period, you could receive the infusion, and it's been shown to reduce symptoms, reduce the viral load, and keep people out of the hospital. But we're also communicating with hospital systems and states. Because this is an emergency use authorization, unlike other approvals for drugs, as a manufacturer, it's not our role to go promote this.
Right.
So we're working through government channels to do that. And as I said, it's quite variable. There's some great examples, but there's also some areas of the country where it doesn't seem to be available when it actually is.
Right, and it's sitting on the shelves, we know, because Operation Warp Speed has said there are about 65,000 doses that go out each week, 5 to 20% of it's actually being used. And this is, these are therapeutics that American taxpayers already bought.
Correct.
If the states aren't using it, or certain states aren't using it, should the federal government claw it back and give it to those who are actually using it?
Well, every week we're shipping more. So the way it's working now is we're being directed by the Warp Speed team to distribute through a third-party distributor to those facilities that are using it. And so we're replenishing those supplies now. And there's many good examples in Houston, in the state of Maryland. They've done a great job. In South Dakota, even after their very difficult fall, they've distributed enormous quantity of what they've received. So we're acting at the government's direction here, and supplies are being replenished. I don't think there's an attempt to bring that supplies back from hospitals. Rather, what we'd like hospitals to do is use what they were sent.
Right. Set
up an infusion clinic where patients with COVID-19 can receive this. And I think we all know, coast to coast, this is not a time to leave that important tool on the shelf.
Right.
This is a time to put it to work against the patients who are suffering.
Right, but what you're hinting at there is one of these challenges we're seeing again and again, is the disconnect between what the federal government is delivering and what the states do when they receive it. And we know hospitals are overwhelmed. So this is a big public health policy issue that needs to be addressed. I'm wondering if you think what you're seeing happen with therapeutics is an indicator of what's going to happen with the vaccine. Are states also not going to be able to distribute it?
Well, I'm not an expert in that, but I can say this is a complicated problem that needs focus and attention from governors and hospital system executives. That seems similar to the vaccination challenge. Here we have about 1 million doses we'll have produced this year, getting those into the hands of hospitals by mid-January. On the vaccine side, we need hundreds of millions administered. So those operational challenges, we're doing something new for the first time.
Right.
It's not simple. It needs focus and attention, and from the hospital on up.
Absolutely. And at the time of crisis, quick action. Are you going to require your own workforce to get a vaccination?
We've discussed this. I don't think there's going to be a problem at a science-based company like Eli Lilly to convince people to get vaccinated. In fact, I think they'll be quite aligned. It's not our turn yet. It's important that frontline healthcare workers and the elderly receive the vaccine first. We totally support that. We do have manufacturing sites that make unique pharmaceuticals that if they can't operate, patients can't receive those medicines. So we're working with the states we operate in to see where in the priority we fall, and then we'll do a strong internal communication about the benefits that's already started, actually, of vaccination. And I suspect most people who work at Eli Lilly will get vaccinated, but it will be their choice. One of the considerations here, Margaret, is it's an emergency use authorization. We don't have the normal full set of data, and if an employee of ours is concerned, we'll respect that concern.
All right. Well, good luck to you. Thank you for your time.
Thank you.
And we'll be right back to talk about that massive cyber attack. And we are learning more about what may be the worst cyber attack in history. It's affected many organizations, including federal agencies. Kevin Mandia is the CEO of FireEye, a cybersecurity company that protects clients against malicious software and investigates hacks. His company was the first one to discover that this massive breach happened. Good morning to you.
Margaret, good morning to you.
The Trump administration has described this as an ongoing attack and poses grave risk to the federal government, to state governments, to private institutions, critical infrastructure. It went undetected for nearly 9 months. How should the public understand this? How significant is it?
Right. Well, there's a lot of ways to look at this intrusion. And first and foremost, it's different than other ones that we commonly respond to. We respond to over 1,000 breaches a year. And what separates this is who did it, how they did it, and what they did when they got in. And I'll get to the who probably last. But when you look at the how, Margaret, that's what makes this totally unique. This was not a drive-by shooting on the information highway. This was a sniper round from somebody a mile away from your house. This was special operations, and it was going to take special operations to detect this breach. So how they did it was in a way that was utterly clandestine, very difficult to tell, and quite frankly, it was a backdoor into the American supply chain that separates this from thousands of other cases that we've worked throughout our careers.
Does it go back further than March? How long have hackers been inside the system?
Well, so right now, what we've observed with this latest campaign, first, I think this threat actor wasn't a one and done. What I mean by that is I think these are folks that we've responded to in the 90s, in the early 2000s. It's a continuing game in cyberspace. You know, there's a time in our lives where the domains that we had espionage in, or the domains that we had combat in, or differences in, were land, sea, air, then space, and now we have cyber. This is just one campaign in a long battle in cyberspace. But this campaign specifically has the earliest evidences of being designed in October of 2019, when code was changed in the SolarWinds Orion platform, but it was innocuous code. It was not a backdoor. Then, sometime in March, the operators behind this attack did put malicious code into the supply chain, injected it in there, and that is the backdoor that impacted everybody. And I think, Margaret, it's important to note, everybody says this is potentially the biggest intrusion in our history. The reality is the blast radius for this, I kind of explain it with a funnel. It's true that over 300,000 companies use SolarWinds, but you come down from that total number down to about 18,000 or so companies that actually had the backdoor or malicious code on the network. And then you come down to the next part. It's probably only about 50 organizations or companies, somewhere in that zone, that's genuinely impacted by the threat actor.
I want to come back to that in a moment, but attribution. Secretary of State said it's Russia.
Sure.
Republican senator who heads the Senate Intelligence Committee said it's increasingly clear this was Russian intelligence. Do you agree that this was Russia? And what evidence do you base that on?
Well, I think that is definitely a nation behind this. You just heard me say the attack started with a dry run in October of 2019. This wasn't a ransomware attack, not a drive-by shooting where somebody breaks in and it's kind of like a brick through your window and it's pretty obvious, hey, they broke in with a brick through the window and then they stole your jewels. This is more like a case where somebody came in through a trap door in your basement that you never knew about, put on an invisibility cloak, and you just got the sense there in your networks, but you weren't even sure how. You were like, there's something different right now. Something's been moved.
But you know better than anyone that there are only a very few number of nation states capable of what you are describing in terms of skill. Russian intelligence, specifically the SVR, has repeatedly been pointed to by officials. Is that who you believe did this?
Right. I think this is an attack very consistent with that. I also believe this. We're going to get attribution right. The amount of resources inside the government, inside the private sector, and the reach that we have, we can speculate it, or we can do some more work and put a neon sign on the building of the folks that did this. And I'm very confident as we continue the investigation, as it gets broader, as more people learn the tools, tactics, and procedures of this attack, we're going to bring it back and we're going to get attribution, not 92% right, not consistent with, but 100%. Let's just get it right so that we can proportionately respond, period.
Right. And it may take time to do that, but I press you on attribution because obviously if you want to stop it from happening again, you actually have to identify who did it in the first place. And the president kind of muddied those waters yesterday when he said it may be China. The media's overplaying it, downplayed the idea it was Russia. I'm not asking you to weigh in on politics, but how do you stop this from happening again? And was it,
well, clearly,
do you have to specifically target one country? How do you do this?
Well, I think you have doctrine. That's why we have doctrine for things like the use of chemical weapons. You saw what happened when somebody used chemical weapons in Syria. There was retaliation. Folks have to know the rules of the game. And the problem in cyber is we're not doing the work to come up with the doctrine. If you publish your doctrine, we're uniquely vulnerable in cyberspace. We're the ones in the glass house. These attacks will continue to escalate and get worse if we do nothing. So, you know, just as a cybersecurity profession, I recognize if you don't communicate the rules of the game, here's the doctrine and here's the penalty when you violate it, we're going to see the borders continue to be pushed outward in cyber attacks to the point where when do we finally do the work? When it's already intolerable, when it already got so bad that we have no choice but to respond. But like you said, it starts with doctrine. With doctrine, you have to get attribution right. And with attribution, then you have to do proportional response to whoever the actors were.
All right. Kevin Mandia, thank you very much for your insight. We will be back in a moment with a look at the economy. We go now to the president and CEO of the Federal Reserve Bank of San Francisco, Mary Daly. Good morning to you.
Good morning, Margaret, and thank you so much for having me.
I would love for you to just give us the bottom line here. We know Congress has pumped in $4 trillion into the economy to help with the pandemic. They're about to possibly pass about $900 billion in aid. Will all of this make a significant difference in propping up the economy?
Absolutely. This support is unequivocally beneficial. If you think about where we started in March when COVID hit our shores and where we are now, it's really remarkable that the economy has done so well. And that speaks to the resiliency of the American people, but of course to the significant support that the Federal Reserve and Congress have taken to ensure that the bridge through coronavirus, over coronavirus, is both strong enough and long enough to get Americans fully through this.
In this $900 billion emerging deal, it looks like Congress will not provide help to state and local governments in terms of financial support. What impact do you think that will have on the jobs market going into 2021?
Well, when I think of state and local governments and state and local communities, these are just a community of people. And so the direct support to individuals, to households, to businesses in those communities really does help state and local governments because they don't have to provide as much for their citizens. Their citizens are getting the income support they need. And importantly, businesses are getting the loans and funding that they need so that they can keep people employed. So I'm bullish on the job market once we get fully through coronavirus, but we're not there yet. So our future is bright, but we've got some challenging months ahead of us as we continue to battle coronavirus.
So it sounds like you are projecting job cuts at the state and local government level in the months to come.
So far, I'm not seeing evidence that there'll be job cuts. Remember that many of the services that state and localities provide are education and police services and social services. And right now we really need those services. So what I'm feeling is that programmatic cuts are being discussed, but right now we haven't heard of people cuts yet. Not in the areas that I serve.
Yet. Last issue on politics, which I know you're an apolitical institution, but the Fed itself was at the heart of the standoff between Republicans and Democrats. And that hurdle seems to have been overcome late last night. It appears that the deal would allow for the Fed to retain its ability to set up emergency lending programs without congressional approval, but block it from replicating programs like it set up in the spring. Is the bottom line here for the American people at home, Is the Fed affected by this? Can you still respond in an emergency, or do you feel like your hands are still tied?
So I'm aware of those conversations. I'm not party to those conversations, but let me tell you what's really important. We have powerful tools, and we're prepared to fully use those tools to support the American people. So for all your listeners, we are prepared to conduct monetary policy, to be the lender of last resort, and I feel ready and prepared to do just that.
And this new provision wouldn't change that?
Again, I'm not aware of the specifics of that. I don't think they've laid out the specifics yet, but I believe completely that Congress, the Federal Reserve, the Treasury Secretary, the American people really want us to be able to deploy our full tools to the best of their benefit. Remember, these are emergency tools. We only bring them out in times of crisis, and then we put them back away. And that's what we're continuing to do. That's what we're prepared to do in the future.
You're a labor economist. You know a lot about jobs. In this latest report we got, it looked like there was improvement. But then when you look inside the numbers, it shows that there are a lot of people who've simply given up looking for work. That seems particularly acute among women. Why do you think that is?
Well, look, women are really in a bind. Many women still are the primary caregivers in their homes, and we have homeschooling now. So women are being forced to make this really hard trade-off and return to home, give up their careers, give up their jobs in order to make sure that their children are well cared for and can get the schooling and education they need. I mean, parenting is also essential work, and these women are taking on that essential responsibility because they don't have the normal school childcare or childcare more generally in the wake of COVID and coronavirus. So we really are going to have to kind of come together to get past COVID, think about how to get these women back in the workforce and back contributing in the way that they really want to do both their childcare, their parenting, and their vital work.
Is this long-term damage to women?
It could be if we don't get focused on what do we do to get out of this. I really think this is a good time to think about national child care policies, the understanding that we shouldn't really force people to make trade-offs between family and work. We should really think of work-life integration. How do we do both? How do we do all the things that are important to us?
Yes.
That's really what our nation will demand.
And that's a conversation we will have to continue having. Thank you, Mary Daly. We'll leave it there for now. We'll be right back. That's it for us today. Thank you for watching. We all wish you a Merry Christmas and happy and healthy holiday season. Until next week, for Face the Nation, I'm Margaret Brennan.